Hey, so all welcome back to my YouTube channel. Today we are going to discuss in short about the deep cervical fascia. As all of you are watching this video, please look into the diagram. First of all, what is the deep cervical fascia? Basically, it involves the six parts. What are the six parts of deep cervical fascia? I am writing down here. First part is our investing layer. That is the outermost layer that binds to all of them. Then we have the pre-tracheal layer. Then we have the pre-vertebral layer. Then we have the fourth layer that is called as carotid sheath. Then we have buccopharyngeal fascia. Then we have pharyngeo-basilar fascia. Okay, so these are the six parts of deep cervical fascia. First of all, it involves the investing layer, then it is the pre-tracheal layer, then it is the pre-vertebral layer, then it involves the carotid sheath, the buccopharyngeal fascia, and the pharyngeo-basilar fascia. Okay, so first beginning with the investing layer. As you can see in the diagram, investing layer is the most outermost layer that is covering all the structures that are present inside. So basically it surrounds neck like a collar. What are the muscles that it surrounds? You have to remember what I am teaching here only. You can study more, but you should remember the points which I am teaching in this video. What are the muscles that it surrounds? It surrounds sternocleidomastoid muscle along with trapezoid. Okay, then what are the spaces that it covers or surrounds? That are the supraclavicular and suprasternal. Okay, then the salivary glands that are enclosed within the investing layer are parotid along with submandibular. So what is investing layer? It covers the neck like a collar. It involves two muscles, that is sternocleidomastoid and trapezoid. It involves two salivary glands, parotid and the submandibular, and involves the two spaces, that is the supraclavicular and suprasternal spaces. Okay, these are the three spaces that are involved in the investing layer. Okay, and more about this is it also covers trachea, thyroid, and esophagus. Okay, investing layer also covers trachea, thyroid gland, and esophagus. So you have to remember these things about the investing layer. Okay, then we will study about the pretracheal layer. What are the important points regarding the pretracheal layer? This pretracheal layer basically involves false capsule of thyroid gland. Okay, this involves the false capsule of the thyroid gland, and it involves ligament of Berry. Ligament of Berry. Ligament of Berry is present between trachea and that of thyroid. Between trachea and thyroid. Okay, these are the two things involved in the pretracheal layer. Firstly, it is a false capsule, and secondly, it involves the ligament of Berry. Okay, what is the function of prevertebral layer? Prevertebral layer basically it forms the floor floor of the posterior triangle of neck. Of posterior triangle of neck. In the next video we will study what are the anterior triangle and the posterior triangle. So till that you have to remember that it forms the floor of the posterior triangle of the neck and it involves the axillary sheath. Axillary sheath. Okay. Where, so wait for a moment. This is our prevertebral fascia. Investing layer, basically it surrounds two muscles, two salivary glands and the two other spaces, and it encircles the esophagus, the trachea and the thyroid. The prevertebral layer basically involves the ligament of Berry and that of the false capsule of thyroid gland, and the pretracheal layer involves this, and the prevertebral layer basically it forms the floor of the posterior triangle and it involves the axillary sheath. So what are the things? What is carotid sheath basically? What is carotid sheath? Carotid sheath basically is the condensation of fibroareolar tissue around muscles of neck. Okay, so what are the structures that are encircled within the carotid sheath that all of you should remember is that I'm making a small little bit diagram. Basically it involves one vein, one artery and one nerve. It involves one artery, one vein and one nerve. It involves, this is our internal jugular vein, this is our vagus nerve and this is our common carotid artery, basically the internal carotid artery. Okay, so these things you have to remember, and there are two small, that is these things. Contents of the carotid sheath are basically these three only. Nothing more that you have to remember is that it consists of common carotid artery, internal jugular vein and vagus nerve, and this is the anterior part of it, this is the posterior part of it. Anterior part of it consists of ansa cervicalis and the posterior part of it consists of sympathetic trunk. This you can draw in a diagram, but only you have to remember it consists of three parts only. These are the basic important things that you have to remember. Okay, these four are very important. Rest you should know all the contents of the deep cervical fascia. Firstly is our investing layer, then it is our pretracheal layer, then it is our prevertebral layer, then it is the carotid sheath, then the buccopharyngeal fascia, and at the last we have the pharyngobasilar fascia. Investing layer basically surrounds our neck in the form of collar involving two muscles, two glands and two spaces. And the pretracheal fascia basically involves the thyroid, the suspensory ligament of the Berry and the false capsule. And the prevertebral layer basically it forms the floor of the posterior triangle of neck and involving the axillary sheath. Okay, and at last the carotid sheath involves one artery, one nerve and the one vein, that is the internal jugular vein, vagus nerve and the common carotid artery involving the internal carotid artery. All of this you have to remember about the deep cervical fascia in very short. If it is asked for just 5 marks, you can write down this. Along with this, do practice of making diagrams from your BDC Chaurasia. It is very important in anatomy exam that you make the diagrams. Without diagram, it is just nothing. So just try to practice making the diagrams, and understanding the concept gets very easy. So thank you for watching this small session with me. We'll meet you in next video. Till then, stay healthy and study well. Thank you for watching my video. If you like this video, please do like, share and subscribe with your friends. Please support. Thank you for watching.